BPC Awareness Month, and we're going to find out together more about this liver disease from an actual patient who has truly become a champion for the cause and helping others on their journey, and a world-renowned doctor, and there they both are. And let's lean into you, Susan. Tell us about your diagnosis.
Certainly. I was led to this diagnosis 19 years ago, and I was just having routine blood work, which showed elevated liver enzymes. I was healthy, working, no symptoms. I went to my gastroenterologist, who was Dr. Abittan, and I subsequently had a liver biopsy, which confirmed the diagnosis of primary biliary cholangitis. So that was basically how I discovered I had it. So it was been 19 years.
Well, Susan, it's been quite the journey, and do share with us, how are you doing today?
I am doing well, thank you. I've learned a lot in 19 years, and one thing would be I've really tried to have a good working relationship with all my doctors. Dr. Abittan has been wonderful in that respect, that I can ask him questions, bring to him my concerns, and have everything answered. I've also learned to live well within the limitations of what this disease is. There are symptoms. The symptoms that I've experienced at times has been a debilitating type of fatigue, where it makes it difficult to do your everyday what you would normally be doing. I have been able to work through that. I had a successful career during all this time. I'm now retired and enjoying my retired life also, remaining active. I do have to get a lot of rest. I try to pace myself when I'm feeling that fatigue, and I try to live as healthy as I possibly can. Diet, exercise, emotionally, spiritually, and I find that that's been helpful.
Well, Susan, we salute you for being part of this very important awareness campaign and helping others along their journey. So thank you for sharing time with us and your story. And doctor, let's pull you in on this. Medically speaking, what is BPC?
Okay, so the disorder is called primary biliary cholangitis. What that means in English is it's an autoimmune inflammatory disease of the bile ducts. The bile ducts are the pipes that drain the liver of its drainage. And anything with chronic inflammation in our bodies can develop scar tissue. So the life process of this disorder, if it remains untreated, can develop scarring of the liver, which is called cirrhosis, over about 15 to 20 years, and that may require a liver transplant. With intervention, we can actually delay or even prevent that process from happening and give people a successful, productive life similar to Susan's. The primary symptoms that people complain about, you have people like Susan who initially present to their primary care doctor, have an elevated liver enzyme. They have absolutely no symptoms. It's identified there's an abnormality. They end up in our office. We do a workup, and then we figure out that they have PBC and then direct their therapy based on that. Then you have a global majority of these people who actually have severe fatigue. They're dysfunctional. They can't work. They have a very difficult time. We dig deeper, we do a routine blood work, and we identify the liver enzymes and take care of it. Then there's a group of patients who will have pruritus or itching of the skin. They may end up in the dermatologist's office or in their primary care doctor. Again, blood work will identify it, and then we'll be able to put them on their road to recovery.
Well, doctor, we certainly appreciate your valuable insights, and given that it is PBC Awareness Month, do remind us where you would like us to go for more information as we wrap, and we want to thank you both for joining us.
Okay, so first of all, as you mentioned, September is PBC Awareness Month, in our partnership with Abittan Pharmaceuticals. We really want to raise awareness of this disease, and also I think it's very important that we are compassionate, empathetic, supportive of those around us who have this fatigue and tiredness or any chronic illness. And most importantly, be your own advocate. Review your own labs, bring it up to your physician, and go for routine visits.